Hello, I'm Dr. Carolyn Richardson, and this is Tips After the Visit, medical information on video that has been helpful to my patients and their parents. You might find this information useful also. Check with your child's pediatrician or medical care provider to make sure that this information is right for you and your child. Today, I will be talking about getting your picky eater toddler to eat. I was conducting a 15-month well child visit on a toddler, and the mother voiced concerns that she was having some difficulty getting the child to eat baby food. I looked through the medical record and I noticed that the child was growing normally and that the child did not have any chronic health issues. The child also was quite pleasant during the visit, and I noticed that the child had been exclusively breastfed when a young infant, and then as an older infant, drank breast milk that was supplemented with formula. I explained to the mother that some babies drink breast milk are sometimes a little slow to accept food because it's a new texture, a new taste in their mouth, and sometimes they just don't pick up on it very quickly. I explained to the mother that nutritionists and experts who work with children with feeding difficulties say that sometimes a child has to sample the same food 20 times before they will accept it. Now, all during our conversation, the little 15-month-old was watching the mother and I. And when I mentioned the part about eating the same food 20 times, the, the child became animated, started babbling and waving their arms. And I told the mother, "Now, see, ma'am, this is no random speech. The child is agreeing with me, and he's saying, 'Mom, you need to try the doctor's advice,' because switching up the different foods is very confusing for the child. But if you give the child the same food 3 times a day for 3 to 5 days in a row, that will give them an opportunity to sample the same food 20 times, and they're more likely to accept it. They will say to themselves, 'Well, they keep sticking this stuff in my mouth. Maybe I'm supposed to eat it.'" The mother looked a little skeptical at first, but then I explained to her. I said, "Don't you notice how some restaurants serve breakfast food all day? That's because the owners of these restaurants have realized that their customers sometimes want pancakes for dinner." The mother agreed to try. So when you have your toddler that's a little slow on taking on food, just be patient. Offer the same food 3 times a day, 3 to 5 times days in a row. Give that child at least 20 times to sample that food and realize that it's okay for them to eat it. A word of caution: if your child has a sudden change in their appetite, you want to make sure that the child is not ill, that the child has not suffered some trauma, or that the child has not ingested some small object that has become lodged in the upper esophagus or the lower part of the child's throat. As long as the child is growing normally and the child doesn't have any chronic health conditions and none of these other issues with trauma or choking on something or difficulty swallowing, once you have ruled all those things out, just be patient. Your child will begin to accept foods, eat a balanced diet, and all will be well. Well, that's all for now. Check weekly for more tips after the visit. Thank you.